There is no other epidemic in today's world that has such an enormous impact on economic and social development. AIDS is in the same league as global warming, massive poverty, the big global issues of our time.
In 25 years of tragedy, 65 million people have been infected with HIV. Of those, 25 million have died. 8,000 die each day. What makes HIV such an effective killer?
A very unique virus. It has the capability of integrating itself into the genome or the chromosomes of the cells of the person it infects. There's nobody who's ever eradicated the virus from the body.
From the beginning, Dr. Anthony Fauci has been a leader in the scientific effort to understand AIDS.
I wake up every day hopeful that the science will get us more forward, and hopeful that other things like sociological issues and leadership issues will get us to a point where we have a much better handle on HIV than we do now.
The complexity of the 16th International AIDS Conference here in Toronto mirrors the complexity of the disease. What started as a science conference is now much more. For 20,000 delegates from every culture and every country, there's hundreds of booths, training sessions, and discussions on the political and cultural quandaries that help spread HIV. Because a cure or vaccine is years away, the conference focused on preventing new infections, especially among women. Keynote speakers Bill and Melinda Gates, who recently pledged $500 million to the Global Fund, touted a new prevention technology.
We want to call on everyone here and around the world to help speed up what we hope will be the next big breakthrough in the fight against AIDS. The discovery of a microbicide, or an oral prevention drug that can block the transmission of HIV.
Microbicides cause for applause and doubt.
People are always looking for the next magic bullet.
Jody Jacobson is founder and executive director of the Center for Health and Gender Equity.
Why are we not investing more in female condoms? Why are we only looking to something that's without question not going to be available for another 5 years, and without question when it is available has to be used with a condom because it's not 100% effective?
Promises of an AIDS panacea have been broken before. But the good news is that 10 years after the development of highly active antiretroviral therapy, or HAART, positivity is no longer a death sentence. AIDS educator Jennifer Veery.
You know, I'm a middle-class professional. I'm a registered nurse who got HIV through heterosexual contact. I'm married now. My husband's HIV negative. There is life after HIV.
That is, if you get the right drugs. Only 20% of HIV-positive patients in the developing world get antiretrovirals. Less than 9% of HIV-positive pregnant women get the one-time drug dose that can prevent mother-to-child transmission. Sometimes medicines are available, but qualified doctors and nurses have left for greater opportunities.
I could earn more money if I worked in a developed world. I mean, I would earn over 10 times the current pay I'm getting in Africa. So many people, when they get opportunities, they move on.
Dr. Balaba stayed in Uganda and brought HIV education and medicine to unlikely allies, traditional healers.
If a traditional healer, on top of giving you this charm for luck, you know, if someone comes, usually people go when they have many marital or social problems. The traditional healer gives you a longer condom, so that works. People then believe, you know, that before you take this charm, please ensure you use a condom.
Like many global problems, AIDS prevention often requires flexibility and local solutions. But there's an underlying dilemma.
Many of the women who are the most vulnerable, many of the children who are very vulnerable, don't have the power in their hands to abstain. They don't have the power to use a condom. They don't have the power to be faithful.
Many speakers, including former President Clinton, stress the importance of women's rights.
The more you empower women, the more likely you are to have prevention programs that work, education programs that work, and turn your infection rate back around.
But is empowering women feasible in poor patriarchies? Maybe. Fortunately, even modest measures help.
In Egypt, for example, women who didn't even really know when they became married how they would get pregnant. That's how ignorant they were kept about their own bodies. When you begin to teach them reproductive health literacy, they then begin to want that for their daughters.
Still, the stigmas of AIDS and sex remain.
I don't know another disease where people are stoned to death, beaten up, because they have that disease. That doesn't happen with diabetes or if you have cancer.
In so many places in this world, people with HIV are fearful, they are not safe. I've talked to people in the lounge and they're like, you know, I can't tell anybody.
Further complicating the matter, religious groups that reinforce the stigma.
In my church in South Africa, KwaMashu, I was kicked out. I was asked to no longer participate in activities of the church because I had sinned. I think the church is really the hypocrite in this whole thing of HIV. The church needs to start saving lives.
Pastor Bruce Sonnenberg has done exactly that, leading an HIV ministry for the last 16 years.
If you were hurt by a congregation or a church or a Christian because you're HIV positive, I'll apologize for them. I'm sorry. That's not what God would do. And over the last 15 years or 16 years, we've seen the evangelical church especially really begin to open up.
For Kay Warren, co-founder with her husband Rick of the Evangelical Saddleback Church, the second largest in the United States, the call to AIDS work was an article on African orphans.
I felt like my heart was broken, and I hope it never stops being broken because it drives me every day to care, to do something, to be a part of a solution, to not retreat into comfort. I'm a seriously disturbed woman.
Clearly, the AIDS effort is no longer just scientists, gay activists, and a few sympathetic celebrities. However, the addition of evangelicals brings controversy. Critics charge that religious considerations have guided President Bush's ABC, or Abstinence, Be Faithful, Condoms policy, and have hindered prevention efforts.
I get real worried when I see the amount of money flowing into prevention activities that are going to evangelical groups who reject or can't, because of their faith, talk about safer sex.
Condoms does reduce the spread of HIV. We don't sell them at our church. We don't promote them in the sense of we don't take them in kits and hand them out to people, but we certainly talk about them. We are not anti-condom. We just don't see condoms. Condomizing the world is not the solution.
There's also passionate debate around needle exchange programs for drug users, the current U.S. ban on helping sex workers, and the ethics of clinical trials and drug pricing. And yet, there is a consensus here in Toronto. The AIDS battle is central to our time, and we can win it.
I have a hope that we will have an effective topical microbicide and that we will ultimately, it's not going to be tomorrow or next year, but we will ultimately have a safe and effective vaccine.
You know, when you take one stride and you make it, you feel, you know, you will take the next stride.
This is just a virus. It doesn't define who you are, but if you can grab hold of it and if you can grab hold of some hope in your life, you know, you can go forward and make a difference.
The International AIDS Conference could have remained as a gathering of scientists and marginalized victims. Instead, amid thousands of inspiring delegates, we see a powerful symbol. The world's richest man and the world's most popular man are embracing the historic challenge.
Bill Gates made a fair amount of money by being able to imagine the future. Do you really believe that he and his wife would be giving all their money away, and that naive Warren Buffett would give all his money to them to give away if they didn't believe not only that people's lives were worth saving, but that they could be saved? That's the best evidence I know. He's got pretty good judgment here. He's not known for making bad investments. And I think that it's silly for people to be cynical when they ought to be hopeful.